Um, Hi everyone. Again, second diabetic complication I want to mention here is HHS, which is hyperosmolar hyperglycemic state. HSS is a little bit uh, different from DKA. My previous video we covered DKA. So HSS now is also patient is also in hyperglycemic state, so their blood sugar is also high, but at this point the blood sugar is greater than 600. Okay, in DKA we said the blood sugar was greater than 250 and it was type 1 diabetes. HSS will be in is seen in type 2 diabetes, but the blood sugar is greater than 600, and there is no ketones. So high blood sugar without any form of ketones. So there's no ketones with HSS, and we see it again in type 2 diabetes. Okay, hyperglycemia. So what are some of the symptoms of HSS? So it will be similar to DKA, right? Because we have dehydration. So it's severe dehydration. Okay, so for HSS, your patient is in severe dehydration, and then their urine output is usually low. So normally we want a patient to put out anywhere from 30 to 50 mLs in an hour. For this patient, it's probably likely that they will not be putting out a lot of output. So as you answer your questions, as you look at those questions, begin to think of it. If you have a situation where a patient has just put out maybe 200 in 8 hours, and you do your calculation, it would of normal urine will be 30 to 50 in an hour, but then patient has gone like 8 hours just for 200, so that's low urine output. So with HHS again, is patient is in a hyperglycemic state, but blood sugar is greater than 600. There's no ketones, there's no ketoacidosis, none of that. The blood sugar is just extremely high, and one of your major symptoms of this is severe dehydration. So if severe dehydration is an issue, therefore we want to make sure that we're hydrating the patient right. So IV fluids. Okay, so IV fluids, we'll give IV fluids, and first then we'll give insulin and IV fluid. um Patients too, at this point, sometimes it affect their mental status, so they become confused. They start showing, some patients start seizing, they have seizures, and if it's not taken care of, the patient could likely go into a coma. Okay, so um this is just a short recap of HSS, which is typically for type 2 diabetes. uh One of the hallmark symptoms of HSS is severe dehydration. Make sure that your patient has a good working IV. Okay, so sometimes it's like the first thing to do just to make sure that the patient has an IV, because if the patient is already in a critical state, if they don't have an access, then there's really nothing you can do for that patient. So make sure that your patient has an access, and then so because when you start resuscitating, begin fluid resuscitation, we need a working IV. We'll give them insulin IV, and the only insulin that we give IV will be regular insulin. Okay, and then we'll monitor them for dehydration and electrolytes. Okay, so when you see severe dehydration, uh I want you to relate it to HSS, because that's the hallmark of HSS, severe dehydration. All right, I'll cut it at this point, and thank you.